Hello, this presentation I'm about to show is going over the HSC position, the Hospital Services Coordinator. Each facility, while in its different area, has different work volumes. The job is still the same, and it should be carried out, in my opinion, this way. The responsibilities that I have listed throughout this PowerPoint is from National. A lot of it I pulled straight off of their website, and also my 4 years experience as well. But most of this information is straight off the National's website. I'm going to go ahead and begin. The responsibilities of the HSC, I'm not going to read through all of these, but just going to highlight some of these bullet points. Obviously, setting up the office there, and that's going to be working with voluntary services for that facility to provide adequate office space and equipment necessary. Any equipment necessary for that office should be coming from the guidance of department of how to get that equipment. Coordinating the volunteers assigned to the VTN program and keeping records. This is numerous different forms, but just to name these: the name of the volunteers, individual volunteer hours, the miles traveled, date, time, place, names of the transported veterans. Number 4, that is going to be shown in a database later on in the slideshow. And 5, any incidents or accidents that occur. This has happened at the Asheville VA, where you have disagreements between the driver and the veteran, or vice versa. And I've had both sides write up small letters is for documentation purposes, and brought those issues up to voluntary services to do as they need to, whether it's disciplinary actions or such. Coordinating the VTN activities with the Chief Voluntary Services. That the VA recognizes the volunteers involved with the program. The Transportation Network volunteers' hours are recorded as official VAVS hours. That's just within basically summarizing up the forms we send into National. Ensuring that all transportation provided by the volunteers has been approved, and we're going to go into the details of how that works with a system called VISTA. Keeping VA Medical Center VAVS rep informed of the activities. Haven't done this in the past, but I do think this part here we should really emphasize. The stuff that the HSC is sending to National for reporting should also be sent in, and any other data for this purpose should be sent to the VAVS rep, and the HSC and VAVS rep should have a great working relationship on a monthly basis. The recruiting, as discussed in prior meetings, recruiting of volunteers for this transportation program isn't as easy as it sounds, but the HSC should take the opportunity of publicizing it within that facility, and also networking, which I'll talk about a little later, with some of the local community, whether it's newspapers or radio stations or news channels. Working with the DAV NSOs and department to establish a budget, such as the office equipment and more importantly, any transportation that might come up, bus fares or taxis, something of that nature. And we have one established already. I think it needs to be looked at when we start defining this position more. Reporting of the activities to Department National, voluntary services on a monthly basis, and that's already self-explanatory. The recruiting, this is what was asked earlier and what the HSC's got to go over. You can read through this. Basically, it's saying that the driver's background check has been done, that they have a valid license, private insurance, and they've gone through their health exams and been approved with all their training to be a certified driver. Coordinating. This is one of, it seems, simple tasks, but yet is time consuming, and the coordinating, when it is done properly, this program goes smoothly and accurate. The first part is the HSC has to answer phone calls and emails from those requesting transportation. That's the chapter-based coordinators throughout the area and local veterans and VA staff that contact and email the HSC on a routine basis. This will also include clinics as well that can have a discharge for a veteran. It is often that some of the clinics, to include the emergency department, contacted the HSC because they had somebody got dropped off and have no means of getting home. That it was a weekly occurrence. Once the transportation request has come in, the HSC has to verify that appointment in VISTA. The VISTA is VA access required. It takes additional requests to get authorization into this scheduler program. We got to confirm that the appointment does meet the standards required, which we'll be going over next, and that confirmation is contacted back to the coordinator or the veteran, letting them know yes or no we can transport. Log in the trips in a database. This is what we talked about earlier, where it's the veteran's name, date of the appointment, and I'll go into a little more detail and have an example of this database later on in the slideshow. The eligibility. Veteran has to have a scheduled VA appointment. We do not transport for any type of surgeries or sedations. Veteran has no means of transportation, that is to include no friends, family, neighbors, or other local programs. It's the HSC's judgment on that part of the criteria. Being able to get in and out of the vehicle on their own will. We can't transport for those that are wheelchair bound. Veterans that have aides with them must have a doctor's written approval, and that is a VA doctor's written approval. And the driver reserves the right to cancel transportation in any event they deem there's unsafe conditions or the above has not been met. The VISTA program, I don't have an example of that to look at, but when we go through the training of the HSC, they would be able to have more detail viewing of it. But overview, the program, again, requires authorization by the VA at that local facility. The HSC looks up the appointment based on the veteran's name, last four, and it will pull up all of their appointments within that local VA catch area, as they call it, such as Asheville has, for example, the out-based clinics, C-Box for Hickory now, and Rufferton and Franklin. So appointments to those areas we would be able to see. However, if a veteran was going from Asheville to Durham, the Durham facility would be the one that would have to look into their VISTA program. So it's only for the main facilities that the veteran is enrolled in or going to that area. This also can require calling other clinics for more details. There's times that some clinics just don't put the appointment in Vista. They just tell the veteran to show up. Well, if they do that, then we're unable to verify the appointment. Thus, we have to tell the veteran to call the clinic themselves to put it in a scheduler, which that can get frustrating for the veteran, but it is required that it is verified. So there are times where I myself was able to call a clinic I could message them through my VA computer and just say, hey, is this veteran coming in for one of the authorized appointments? Here's an example. Now, this isn't the actual form or database that we used at the Asheville VA. However, this is just an example of what it looks like. To the left, it's pretty self-explanatory. You got the date, veteran's name and last four, and the pickup location, whatever area they're out of, where that van's leaving from, and then what facility is it going to? It's the main facility, or is it one of the out-based clinics? The mileage part, this is more for the VA, keeping track of the cost savings. So if the veteran pickup is, in this case, Burnsville, and it's about 74 miles from Burnsville to Asheville, or round trip thereabouts, then we multiply that by 41 cents. That's what or whatever the going rate for travel pay is per mile, and that local facility can keep track of how much money that our program is saving. I found this to be very helpful when going out and seeking donations, or other chapters seeking donations for newer vans. We're able to indicate what our program is doing with the local impact and money that facility can use elsewhere. Networking, it is vital that the new HSCs or the HSC should know the executive staff, the director, associate director, the chief of staff that's over all the nurses and doctors, social workers, facility, fleet manager, that's the one dealing with our vans, and the clinic supervisors, others deemed as appropriate. The reason being is that by knowing these individuals and by networking, when it comes into needing an answer, the clinics, the individuals know how to do it off of basically a first name basis. You can get the job done in a lot less time by having that personal relationship. And also that the social workers have a face, and just the facility staff have a face to this program, which is widely known throughout these facilities, and they know how to and who to get in contact with to answer any questions they may have. The paperwork. These are just some basic forms. I'm not going to go over this. You can read in more detail. This is from National, but this is the basic forms when we report up. If you're wanting more detail of that, just email me, and I can actually send you the examples of each form. This is for basically this is for the ones that any DAV volunteer that comes there, not just specifically for the VTM program, but if they're at that facility volunteering, they need one of these forms. This is whenever the HSC changes, or if the phone number, email, any of that changes, it needs to be notified to National. What I found too is because I had an email, I could just email directly up to National. That is an option. This form is to be done once a month, and you can read through this for all the details. This is an addition to the last form. and this one's to the VAVS Form 45 should be attached. Give me a second to read through it. Not exactly sure on this form. I'd have to look that one up. If you got questions on the VAVS Form 45, just email me and I'll research that. Additional forms. Turned in monthly is the mileage check sheet, safety checklist, and also any gas car maintenance receipts. This is what the coordinators or drivers should be turning in monthly. What I would do is take these, combine them together. I had a good process in relationship with the fleet manager here there at the VA, and once a month I was just able to take all this down for him for his records, and the system worked beautifully. HSC should be the official contact of the DAV, and this is to include, obviously we talked about the transportation program. That's calls and emails from it. I received on average 50 phone calls a day, and emails, to include emails as well. Membership, it's when anybody has questions on membership. I did have at least a few a week. People just wanted to join or find out the status of the membership. General claim information. The HSC should also be certified, in my opinion, as a service officer. Doesn't mean I'm not trying to combine DSO work here, but however, since that HSC is the official contact when it's general information, and or if they have additional time to check status of a claim for a veteran, that's going to be very beneficial to explain the process of how claims work. It will be very informative for the veterans and can save a lot of time in the future, but also that HSC can direct the veteran to the local chapter in their area. I do think it is vital that the chapters within the area of the main facilities, the VA or the C-Box, if it's in their area of operation, I highly advise they have a CSO that it provides that service at that facility at least on a once a week basis. I understand there's local chapters that have their areas where they do out of their own buildings. I still think it's important or highly suggested that even if there's a local chapter that has their own facility, there should be a service officer at the at the main VA facilities if possible. When we answer and return phone calls, the customer service and the veteran's happy. When it doesn't, obviously, even with ourselves, we understand how frustrating it can be. The VA process and how it works is very frustrating enough. We don't need to add any more stress. By having just an HSC and not having the volume of traffic that the DSO responsibilities had on top of that, this is where the customer service part is going to be substantially improved. And I think we can get a lot more accomplished on the DAV aspect with our customer service and awareness of our organization. Here's just a quote of the day. And if you have any questions, this is just a rough draft of the HSC position. In my opinion, it is definitely every bit of up to 36 hours worth for sure a week of work. In order to be able to do this job effectively, accurately, and to expand on it, to make it such a success, would at least require that amount of time. If you need any details concerning this program or areas of questions, please email me at Clark, CLARK 828 at me.com. Again, that's Clark 828 at me.com. You can also reach me by cell. I'm going to type that for you right here. Here's my email. And my cell phone is 828-273-4975. I do appreciate y'all's patience waiting for me to get this set up. I've been having some issues with the VA and some access. I was trying to get some more documents out of it and some of the PowerPoints that explain the VTM program a little more in depth, but I think this is a good enough overview to get started for right now.